You're watching UNICEF television. For over a decade, HIV-positive pregnant mothers in South Africa would rest assured that they would stop the transmission of HIV to their babies by not breastfeeding, and instead feed their infants the free formula provided by the government's Prevention of Mother-to-Child Transmission program. What they didn't realize was that they were very often exposing their infants to other deadly childhood killers, like diarrhea and pneumonia.
In the context of HIV, we've had an inquiry into why children are dying, and we know that children die in the first 28 days, called the neonatal stage. And from those children that have died, 60% of them died because of malnutrition, specifically going back to diarrhea. And the reason why children die of diarrhea is because firstly, the immune system is not developed, so they have an immature immune system. And then the feeding options mothers are choosing, specifically around formula feeding, is that we have an introduction of contaminants.
This is all about to change as the government takes the first step in rolling out a new policy that aims to bring down the stubbornly high levels of infant and child mortality. Despite being Africa's biggest economy, South Africa is not on track to meet the Millennium Development Goal of reducing child mortality. The World Health Organization says that breastfeeding is one of the critical ways to improve child survival. In South Africa, though, only an estimated 8% of children under 6 months are exclusively breastfed. So in line with the shift in global policy, the government will now endorse exclusive breastfeeding for the first 6 months of a child's life, and continued breastfeeding for 2 years or beyond. In addition, the transmission of HIV during breastfeeding can be drastically reduced by providing antiretrovirals to mothers or their infants. As part of this move, the government will stop the free distribution of formula in the PMTCT program in all public health facilities. Free formula will only be provided under exceptional circumstances and for special medical cases.
When the WHO issued their international guidelines, and they were basically saying, we've looked at the evidence, we've weighed up the risk. Yes, there is a small risk of HIV transmission through breastfeeding, but we know how to make it safer if the mother is either on treatment or if the baby gets prophylaxis. We can reduce that transmission down to 1 to 2%. And we know, on the other hand, very strong clinical evidence that not breastfeeding or breastfeeding for a very short period of time increases the infant's risk of infant mortality.
Leading the way in this policy shift is KwaZulu Natal, a province with the highest HIV prevalence among pregnant mothers. It's already rolled out the changing policy through an extensive training program among health workers and community caregivers to promote the benefits of exclusive breastfeeding. But changing a policy is one thing, changing mindsets is another.
It was very, very difficult because people were not understanding. You had to really talk to them, intensive counseling, and sit with them and explain how important is the breast milk.
And what makes it easier is that the message is finally clear-cut.
We're now unifying the message and we're simplifying it, and we're having one message for all mothers regardless of HIV status, whereas in the past it was, if you're positive it's different, if you're negative it's different, if it became very complicated in terms of what the actual message is.
And the message from the evidence available and the KwaZulu Natal experience is that breastfeeding is without doubt the best option for all mothers. This is Suzanne Bierkes reporting for UNICEF Television. For more information, go to unicef.org. Unite for Children.